And for the wrist, first thing again, you want to do the Tinnels. For the carpal tunnel, you can do the Tinnels right here. And then for the Guillain tunnel, for the ulnar nerve distribution, you can do the tapping right here. Both of them just kind of noticing for the numbness, tingling, or pain, and the dermatological distributions. For the, since we did a carpal tunnel right here, other carpal tunnel tests you can do is, one of them is actually, sometimes we'll also talk about the compression test. You can compress it, but then the one you guys learn is like Phalen's. So you're gonna hold it there, ask the patient to hold it and see if there's any numbness, tingling on the median nerve distribution. So that's a Phalen's, and there will be a reverse Phalen's. So you can do this way to actually stretch some of the median nerve right here, and then a lot of times with the compression and the stretch, it will also cause numbness, tingling, and pain distribution patterns. Those are for the carpal tunnels. If the carpal tunnel goes worse, and sometimes there's a weakening of the muscle fibers. If there's any of the weakening of the muscle fiber, that's kind of immediate referral. One test that you can do is a pinch test. You're going to ask the patient to pinch the paper right here, and then usually patients should be able to hold it if I try to pull it, okay? So they should be able to. But then if there is weakening in the muscle, and then if I pull, then you will let go, and if this will be a positive. So you can do the testing on each finger. So index finger, okay, strong, middle finger strong, ring finger strong, okay, median nerve is good. But then it comes in the ulnar right here, and it was weak, then you will suspect something going on in ulnar nerve distributions. That's the pinch test. There's also another test, it's called pinch grip test. Pinch grip test is you ask the patient to make the little circle there. If the patient is not able to make the little circle with tip of the thumb and index finger, if you start becoming more like this, a little bit flat right here on the dip joint, that means that flexor profundus, the deep tendon, is not working. And the muscles, the innervation is that there's anterior interosseous, the nerve is being pinched. A lot of time anterior interosseous nerve is entrapped by the pronators. So this will be a positive if the patient do this rather than be able to do that. So that's going to be a pinch grip test. Another test that a lot of times I do is that asking for this strengthening of the grip. So I ask the patient to squeeze as hard as they can and to compare right and left and be able to check for the strength of the grip.
Finkelstein?
Finkelstein is for the veins right here. What you want to do is that you're going to try to find those extensor pulsus, longest tendon and all that. Then there'll be a lot of tenderness right here. You ask the patient to just bring the kind of flex the thumb and squeeze. And a lot of times this itself will be a pain. Then if it's not a pain and you still suspect, then you're going to bring in the ulnar deviation. You can do the passively, or you can actively ask the patient to do. Either one will be positive.